becoming a second or third tier hospital. So as much as people like Evangelical and they want to come to it, they won't pay more to do so, all right? So, for instance, I was part of the UPMC health plan, all right? But because we are not a UPMC hospital, we're in tier 2. All right, so somebody that buys the UPMC health plan may say, hey, I can go to Evan to see the OBGYN that I've always seen. They come in, they may pay $100 out of their pocket instead of have a free visit, and they may say it's worth it. But if that individual went to have a child and found out what they have to pay to go through the whole labor and delivery process out of their pocket, they're not going to come to me. So the payer issue was a big one for us. The other one was IT. We have all kinds of information technology systems, whether in the emergency room, inpatient, outpatient, lab, imaging, and we're interfacing all of these systems, and it's not one complete system, which is what the physicians want. It's not an integrated delivery system, integrated electronic health record. So those were where our weaknesses were. So we spent quietly about a year and a half trying to determine what our future direction should be. This was a board-led initiative, and the board really felt strongly that they wanted the hospital to remain independent, but we needed to form a closer relationship with someone. And so we made the decision that the best partner to do that with was Geisinger and the Geisinger Health Plan. And so, to be honest with you, most everybody wanted to take us over. And Geisinger was excellent at acknowledging the fact that in a rural kind of setting in which we live, we share many patients. And people will come to me and say, Kendra, don't sell the hospital to somebody, don't merge with Geisinger. And I'd say, well, didn't you just have open heart surgery? Well, yeah, and I said, well, we couldn't do a stent here on you, so I sent you to Geisinger. Wouldn't you rather that I have a really good relationship with them and that your time in getting there and being cared for is appropriate? So it's okay. Like, I have excellent relationships with Geisinger, and I'm very proud of that, and we are very blessed in this region to have incredible tertiary care, incredible health care in general in this region. But our board felt that we could continue to best serve our people by remaining independent. And so, Geisinger was willing to make an investment in us, and together we are going to invest money in this region over the next 5 years to strengthen healthcare. And so what we got out of it initially here is we got our health plan strategy. So instead of being a tier 2 provider in the Geisinger health plan, we're tier 1. We're treated as if we are a Geisinger hospital as far as our patients having access to us in the most affordable manner. We got the IT strategy. We are in the throes of transitioning every computer system in the hospital, whether it's Epic, which is the electronic health record, and all the clinical and business platforms over to those systems of Geisinger. And if you really put the patient first, we are constantly challenged by not being able to easily access patient information. So you come into my emergency room and you get sent over to Geisinger because of it's a service that they need to render. And all of the information is shared again because it's not easy for the physicians to get in and see what tests were ordered. And over time, that can drive up the cost of care, but it's just not the best care for the region. And so physicians are very happy about this, and it's the way the consumers seek care in our area. And then we're in the midst of determining other joint ventures that we can do together that we wouldn't necessarily do by ourselves. And I'll get into a little bit of that later, but I want to talk to you a little bit about this notion of co-opetition. If you've ever studied this in economics, there is a big economic theory, and it plays out all over the place, but you can cooperate and you can compete. And as long as both sides come up with wins, it makes sense to cooperate and compete. And that's what Geisinger's doing. They are a competitor. I am a competitor of theirs. But we are cooperating because it's in both of our best interests. But the reality of it is it's in the best interest of the community. We can together provide good care, better care to our patients. And so we cooperate and we compete. So there are all kinds of protections and firewalls, and I can't share certain information with them. They can't share certain information with me. But we are sitting down and have meaningful conversations about how together we can improve the health care in this region. And one of the first things we decided to do is acquire the Miller Center. And so this is going to be called the YMCA at the Miller Center, and I promise you it's not going to always say powered by Evan and Geisinger. It will be much briefer. You may see a bunch of logos on the side of a building. It's a big building, though. So we decided that it made sense together to acquire this building, and so, or this property. We have established between Geisinger and Evan, and this will go into effect on Monday, December 16th, a nonprofit corporation. When you establish a joint venture, there's a majority interest. So because it's in Lewisburg, it's part of our community. Evan has a 51% stake in this, Geisinger has 49%. The Miller Center is a nonprofit, and while the Miller family generously came into the community and used their monies to build this, they then established a nonprofit organization. And so when a nonprofit takes over a nonprofit, it's called a member substitution. So out comes the Miller Center nonprofit, and in comes the Evan and Geisinger nonprofit. We'll each get equal board representatives. There will be some YMCA representatives and some current Miller Center board members serving on this board. Because we are competitors with Geisinger, everything we do with them has to be reviewed by the state attorney general. This is a gym, basically, so there should be really no competitive issues, but it has to be reviewed, and it has to go through the orphans court because it is a charity, and so it has to be reviewed and make sure that it's clean. We will close on Monday, December 16th, and then we engaged the YMCA to manage the day-to-day operations of the facility. This honestly came about. I had the opportunity to have some conversations early on with the Y as they began to try to build a facility. You all know they were going to take the old vacant Walmart and turn it into a YMCA. And I just happened to be, when this came about, and this opportunity came about with Miller Center, I happened to be in the right position to see the financials of both organizations. And it was clear to me that this community isn't large enough to support and have two financially healthy organizations in their community. And so it was under that we all got together, Geisinger and Evan. We spent a lot of time, Geisinger and Evan, trying to get out of our own ways to make our own deal work. And we had to do the same thing with the Miller Center and the YMCA and acknowledge each other's strengths and weaknesses and how together we could accomplish what was right for the community. I'm very proud of the work that people did to pull this off, and what this can be is yet to be completely defined. I believe there's that much opportunity in this facility to better serve the region. The area YMCA is going to run this, and they will hire the branch manager of this and run it all. Most of the employees become YMCA employees. The non-fitness, the custodial, and the nutritional staff people become EVAN employees because, the Y doesn't know about running those types of services we do. But we hired a gentleman named Ryan McNally. Some of you may know him. He works in community health at the hospital. He's from Mifflinburg. He's a great young guy, and I think he's just exactly the right person. This is a relationship kind of position where you need to work with Evan and Geisinger to drive certain programs into this facility, but work with the YMCA to manage the day-to-day operations. And together we've pledged that we will all work together to make sure that this area gets a swimming pool, both a competitive pool as well as a warm water pool, and childcare, which we have great need in this region for more childcare. This is just to show you a map of what this looks like. This is where the Miller Center is. We're still undergoing the designs of where we would put the pool. We've thought about putting the pool here and the childcare in the back, but we're looking at several different options of that and pricing. This is a 6-acre parcel of land and a 3-acre parcel of land. This is the giant. This 3-acre parcel of land is owned by a real estate company that the Millers have, and this is where they're going to start building a hotel. And then this is a 6-acre parcel of